How does scoliosis cause uneven shoulders? Scoliosis induces a lot of uneven forces to the spine and the surrounding tissues and body. And these uneven forces disrupt the body's overall symmetry, including the shoulder blades and shoulders. And when we look at scoliosis, it can affect postural deviation is normally the main symptom. And this postural deviation typically is evaluated in childhood scoliosis. And uneven shoulders and hips are some of the earliest signs. And this happens because as the spine curves, it causes asymmetry to the ribs and torso. And it causes more than just a postural change. It really affects the shape of the torso. And this asymmetrical shape leads to uneven shoulder blades and uneven shoulders. And this is typically associated when you're looking at a thoracic scoliosis that's going up into the cervical spine. And the most common finding would be, is it going to be a left low shoulder and a right high shoulder? And normally the right shoulder will be forward and the left shoulder will be back. And the patient will kind of present kind of like that. And when you look at this, this is happening as a structural association with the scoliosis. In addition to uneven shoulders, there could be a development of a rib cage arch, uneven waist, uneven arms and legs that appear to hang at different lengths. Scoliosis can also affect balance changes in coordination and gait, because as the scoliosis affects the shape of the torso and the spine, it can affect body awareness. Scoliosis progression is normally triggered by growth, and this means that the unnatural spinal curvature is increasing. And as the curve gets larger, the condition's uneven forces also increase with the effects it's causing, meaning that shoulder imbalance and rib imbalance and shoulder blade imbalance could become larger. And as it progresses, the effect becomes more and more noticeable, and then what the patient actually sees can make it more likely that the person will become diagnosed. However, as curves are small, they could be harder to diagnose, because normally what we see is typically what brings on the diagnosis in children. What stops scoliosis from expressing its significant effects is proactive treatment that works on counteracting the progressive nature of the scoliosis that happens during growth and development. Now, when we look at postural changes, the first question we want to ask is, if you're already expressing shoulder imbalance, rib imbalance, shoulder imbalance, is there a way to improve the shape of your torso? Yes, there's definitely ways to improve the shape of your torso, but the best way to do it is by proactively treating the scoliosis. And it's really trying to treat the scoliosis on a structural level. The best way is to treat the scoliosis before it progresses into severe levels, because if you can treat it before it progresses into severe levels, you're prevented from ever happening. But once it's progressed, what can we do about it? Well, we know we have to address the scoliosis really on a structural level, and this is typically done as a focus of a conservative non-surgical treatment model. And this normally involves combining many different treatments into a point that's going to reduce the scoliosis on a structural level to improve the postural changes or trunk symmetry that's already occurred. And this is the attempt that they're trying to do to try to reduce scoliosis on a conservative approach. So when we impact scoliosis on a structural level, we can stop the expression of these negative effects like uneven shoulders and uneven symmetry of the body, and we can start expressing the body in a more natural approach and develop more symmetry. And since we know it's a structural condition, what we're really looking at is very specific treatments that can not only unbend and untwist the scoliosis, but it can also affect the muscles that are associated with the scoliosis and can also affect the body development associated with the scoliosis. So to counteract all of these effects, we look at many different treatments, and one being condition-specific chiropractic care. And this normally involves a number of techniques and adjustments that are going to help reposition the spine back into a better alignment. And this is typically involved using different types of techniques, and they're normally very conservative and mild in nature to help adjust the spine and help move the spine closer to normal. In addition to adjusting the spine through chiropractic care, we also know we have to address the muscles, and this is done typically using therapy and rehabilitation. And there's normally two main types of therapy and rehabilitation that can be performed, something that I call passive therapy and active therapy. Passive therapy can have a significant impact on scoliosis because there are machines and equipments that are used to help push the spine into a straighter position to affect the structure of the spine. And active therapy could be a combination of isometric exercises and scoliosis-specific exercises that are done to help strengthen the muscles and tissues in an asymmetrical manner. Lastly, we can talk about is something called corrective bracing. And corrective bracing can be used to help shape and remodel the torso into a more symmetrical position. If all three of these things are performed in a viable way, normally we can reduce the scoliosis, stabilize the reduction, and improve the expression of the scoliosis. Lastly is taking all three of those components and try to replicate as much as we can on a maintenance basis at home using home therapy, home exercises, and home bracing. And these things help the spine heal in the correct position and help negate the effects that scoliosis had on the body during its development. Now we know the symptom of scoliosis, the most common one, is uneven shoulders that are impacted by the scoliosis itself, causing this curve to develop, leading to this uneven shoulders. We also see rib arching and uneven hips. But addressing the scoliosis means addressing its effects. And the way you address the effects of the scoliosis is by reducing the causation that's associated with the scoliosis, and that is the size of curve. And by reducing the size of the scoliosis, we try to improve, reverse, and prevent even more of these effects from developing. But this requires a proactive, conservative treatment program for it to be effective and also for it to provide the best outcome possible. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.